Dizziness isn't hard because it's complicated. It's hard because it's vague. Your MP Pal here, and welcome to another lesson from the track. Alright, so today's segment is called Dizziness, how to rule out the dangerous causes. Okay, so if I strongly dislike abdominal pain, I dislike dizziness even more. Why? Because they all complain of dizziness. Everybody. It doesn't matter what they're in there for. They can have a list of symptoms. Oh, my elbow hurt. I have back pain. My right pinky toe burns. I'm dizzy. What? Where did that even come from? This doesn't even make sense. And in the ER, everybody that had a complaint of dizziness, we had to do a neuro exam. Every single person. I mean everything we had to do it. And almost every other patient had dizziness. So I know y'all feel me on this. I know y'all do, okay? Because even from little kids to the elderly, like that is one of those complaints. And the thing is, not a whole lot you can do for it, and it's really hard to figure out, okay? So, of course, always think worst case scenario first, and then work your way backwards from there, okay? So, of course, if they have dizziness with any other neurological symptom, time out. Okay, let's stop. Any drooping, any numbness and tingling, any other symptom with that, you need to go. I'm not even gonna, no, let's just stop this right now. So if it's something where I hear like from the front when they're checking in, I'll stop them right there. Yeah, you need to go to the hospital. Now I know the companies, they want you to get them in and stuff like that and blah, 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 which, okay, that's fine. Yes, get them in, evaluate them, do your medical screen, get your vital signs and stuff like that, because this may be something where it's an ER transfer, okay? So, especially if they're elderly. So, I'm not saying just dismiss the people, okay? Get them back, evaluate them. But, yeah, it's, I see it at least once a shift. I mean, somebody's dizzy. Now, of course, you're thinking of bad things. So is it neuro? Is it cardio? Is it positional? Or is it something benign? Because it can be either one of those. But the one we can actually do something about is vertigo. And so, of course, as far as medication and stuff like that, you can do meclizine. But how I normally approach this, depending on the age of the person, it's just vague. Like if they don't feel like it's spinning and they don't feel like they're passing out, they're like, I don't know, I just feel dizzy. Right? And then you do the exam and everything is normal. It's not positional. I'm sorry, y'all. This is one of those complaints. So what you can actually do in the urgent care, I usually always get EKG. I like to have them do a blood sugar and then do orthostatics. Those are what you can do. That'll give you something, or at least cross some stuff off the list. I don't ever usually even get to a cause. Oh, this is the reason. Even in the ER. I mean, we would do that right? But at least in the ER, you can get fluids. And it's crazy how normal saline can fix so much. It fixes everything. Just give them a line. But you don't have that luxury here. Yeah, it could be dehydration. Yeah, it could be so many things, okay? So I don't spend a whole lot of time on these people. So if they're not having a neurologic symptom, EKG is fine, blood sugar is normal, orthostatics. All right, cool. So this is what we have left. And I'll just kind of go over everything with them. It could be vertigo. If it is vertigo, one thing you can actually do in the office that can help is the Dix-Hall pipe maneuver. So even with that, I will explain to the patients what it is, and then I can tell them how I can fix it if they want me to. But if it's really, really bad, like I had a guy a couple weeks ago, I threw it out there to him, and he's like, no, man, I just threw it before you came in here. He's like, don't make it worse. So you can actually tell them how to do it. Like you can walk through, or there's always printable PDFs. So I actually, I demonstrated it for him. Like I told him how to lay his head back and, turn over, or turn to the side, sit up. Like I went through the whole thing with him, and I printed out something for him. And I'll just tell him, hey, you can Google a quick or like a video, something that you can watch to do it at home. So that's something that you can do there. But that's really all you can do. I mean, to be honest, check the vitals, get a history, EKG, blood sugar, and orthostatics, and then tell them to stay hydrated, of course. But and they half are satisfied, half may still be upset, and so it was crazy. So this flu season, I've seen a lot of dizziness. So a lot of the flus actually caused it. So that was great, because if they had a positive flu, like, oh yes. And that was from like little kids, because I remember it was more flu A. Like flu B this season was causing more GI, but I saw more like dizziness with flu A. So, and that was like the only complaint. They would come in there and they would just, oh, you're so dizzy. Oh my gosh, you're so dizzy. Oh, okay. Let's run a flu and come back positive. I'm like, yes. So yeah, so she has the flu. Oh yes, this dizziness is right. It's nice when you have a reason, like right. You can actually explain. You can tell them, oh, this is common with this, right? Because people accept that, and then cool, I can fix this. Let's get you better with this, okay? So that's it. I'm not gonna spend too much time. If they're really sick enough, they need to go, but. Like, what blood work are you going to do? What blood work are you going to do? Okay? Even you can check a urine if you think they're dehydrated. Okay, what is that? You know what I'm saying? Like, you can just ask them questions. Have you been drinking the fluids? Have you been blah, blah, blah? Kind of go from there. I mean, if you just want to do something, but I don't sit on these people too long. I really don't. Like, they come in there, I have the text already. Go ahead and do that. Just go ahead and get the EKG the way we can cross off cardiac. Get the sugar just to make sure they're not hypoglycemic, and go ahead with orthostatics. Get that out the way. And that way you walk in there, so I've done this, and this, okay? I don't think it's, anything right now. You're not having any neurological symptoms. Just tell them what they don't have, go through those pertinent negatives, and that'll help to kind of calm them down sometimes. But that's really all you can do. I don't spend a whole lot of time in there with these, because what are you actually gonna do, okay, inside? But again, even if nothing, it don't really sound like vertigo, not a lot of fluid behind the TM, I'm still like, hey, I can give you this medicine, we can try it out, may or may not work, but you may want to follow up with your doctor. But getting basic labs, and just like, basic labs are the default for so many things. But if it's not going to change management, why are we doing this? Okay, it's not common. They'll say that, well, can we just get some blood work, to see what's going on? They don't know. That's why we are supposed to tell them. There's not a test that's going to tell me if you're dizzy or not, okay? Now, if you're thinking anemia, okay, they're probably going to have a little more symptoms. But even then, if they're fine right there, they're not pale, they don't have any of the signs, I mean, they can follow up with their doctor. They can go do that outpatient, because again, you do it, and then let's say they are anemic, then you have to do something about it, right? So it's like that, and if they're sick enough in that moment where they're dizzy and they're anemic, they may need a transfusion. So if they have other symptoms, like they're pale too, they don't need to be there. Don't try to just give a pill, like, don't, okay? So, because sometimes ordering that stuff, like people like to just order a bunch of tests and then hope you find something, but that's actually not good practice, okay? For just the normal, regular dizziness that we see in urgent care, routine labs are not a part of the treatment for that, okay? So, do what you can, orthostatics, get EKG, get the sugar. If it's vertigo-like, prescribe meclizine, have them follow up with the doctor. And that's really all you can do, okay? Don't spend a bunch of time, don't check unnecessary labs, because it's not going to tell you anything anyway, okay? All right, your RP pal here. Practice boldly, and I'll see you on the next one.